Good morning, ladies and gentlemen, and welcome to our May 18th, 2022 First Human Services Board. It's nice. It's been a long time since we've had this many people sitting around the horseshoe up here. It's nice to see some new friendly faces. And so I will call our meeting to order, and roll call, please.
Julie Medeiros.
Here, present.
Lisa Lind.
Here.
Sean Anderson.
Present.
Kathy Leaf. Present. Dave Osnes. Greg Telejohn.
Present.
Mike Barkalow.
Present.
Deb Lindeman.
Present, sorry.
We have a quorum. Everyone had a chance to look at our minutes from way back in March. Any additions or corrections? Seeing none, those will stand as approved, and we'll not move on to public comment. Is there anyone here wishing to speak to anything on or off the agenda? Second, third time, is there anyone wishing to speak to anyone on or off the agenda?
We had an email that came into the
What?
board. There was an email that came in. Is this the time where we?
No, it does, it's filed. Go ahead.
Okay, sorry.
Nope.
Never mind.
Okay. See. Hello, young lady. And Sarah Bachlan.
Hello, everybody. So I was just wondering, I wanted to, maybe you can't answer this question, but can you confirm that the HHS subcommittee is not a present and active committee? Okay, that was just old information that was left down there. Okay, that's all I have. Good job, everyone.
Okay, thank you. Anyone else wish to make public comment? Seeing none, public comment is closed. I've been appointed as the convener for this particular meeting. We always do that after the elections in April. And I think one of the things we'll like to do right now is with so many new faces around the table, we'll go around and just everybody, well, I'll start over here with Deb. Introduce yourself and give us a little bit of a background.
My name is Deb Lindeman. I am a registered nurse. I'm the registered nurse representative to the HHS board. And I retired in 2018 as the health officer for St. Croix County, and worked for St. Croix County as a public health nurse and then as the health officer for 5 years. And I came from, before I was the health officer here, I came from Mayo. I worked at Mayo for about 3 years.
Sean Anderson, I represent District 2, and this is my second term, first term on this committee, and I am an engineer by trade.
Julie Medeiros. It is my first time serving on the board, and I am a registered nurse, and I work at Regions.
Greg Telejohn, District 14 Supervisor. This is my second term, and this will be my second round on the Health and Human Services Board.
I'm Kathy Leaf. I represent District 4, and this is my second term on the HHS board, second term on the St. Croix County board. I do marketing as my trade.
And I'm Dave Osnes from District 10. I'm starting my 5th year on the HHS board. I hate to admit it, but I'm happy to admit it at the same time. I'm starting my 13th year on the county board. I serve in the Wisconsin County Association's Health and Human Services Board and also the NACO Health Policy Steering Committee.
Lisa Lind, District 1, represented. I am a nurse, 30 years in newborn intensive care, retired in 2018, and now this is my full-time.
Mike Barkalow, District 16 Supervisor, and I'm in sales and marketing, jack of all trades, master of none sort of situation, but this is my first term as a representative.
sorry, I didn't know we were all introducing ourselves. Thank you. Heather Amos, Corporation Counsel. I was confirmed as Corporation Counsel February of this year, but I've worked for St. Croix County since 2002 with a brief stint in Eau Claire for 2.5 years. And so welcome all to your committee.
Faye Strenke, Fiscal Manager for Health and Human Services. I've been with St. Croix County for 27 years, Fiscal Manager for the last 3 years.
Good evening and welcome new board members. My name is Bob Raritan. I've been here for 2 years now as the Director of Health and Human Services. Prior to this, I was at Hennepin County and also worked at Ramsey County.
And I'm Colleen Linder. You've probably all gotten emails from me. I'm the face with those emails. And so I am the meeting organizer for this committee. So if you ever have questions, concerns, you can shoot them my way. And also I work directly with Bob. So if you have something that you would like to get to him, I can certainly help you with that. So welcome.
And thank you, everyone. For our new folks, Bob and Colleen, if you have some questions, Bob and Colleen are some good folks to get a hold of right away. All the folks in the back row, all those good-looking ladies back there, they're all staff members, and they can also help you with any questions. So don't be afraid to ask if you've got any concerns or questions. That's what they're there for. And with that, we'll move on to item number 2, which is the election of the Health and Human Services Board. Nominations are now open for chair. Are there any nominations? Sean?
I would like to nominate Supervisor Telejohn for chair.
Any other nominations?
I second that nomination.
Go ahead.
I second Bob's nomination.
Okay. There's motion and a second. All in favor of Greg Telejohn as the new board chair, say aye.
Aye.
Opposed? Greg, congratulations, and you can take over the meeting.
Oh, thank you, everybody. Okay. Election of a Health and Human Services Board Vice Chair. Is there any nominations for Vice Chair?
I'd like to nominate Sean Anderson.
Any other nominations?
I'd like to nominate Kathy Leaf.
I second Shauna's nomination.
Okay. Any other nominations? Is there a second? Supervisor
Barklow seconded.
Okay. All in favor of Sean Anderson as Vice Chair, say aye.
Aye.
Opposed? Nay? Abstentions? Congratulations. I guess I got to keep reading here. Establish meeting schedule of the Health and Human Services Board. We get to set the day and time? Is it?
It's already established, isn't it, Ken?
It's the ability to change it if you want to.
Okay, it's currently it's what, the third Wednesday of the month at 5 o'clock.
Visual aid.
Yeah, I put in your packet, so I highlighted what it would look like to be the third Wednesday if we continue that way, just so you can have a look at when meeting dates would be. But it certainly can be changed if that's your choice.
Mr. Chair, we will be meeting here.
Pardon?
We will continue to meet here, correct?
Yeah. So we want to continue the same time and place?
I prefer that it stays. I don't know what anyone else says. Thanks.
I'm sorry, what?
I prefer that it stays the same. I don't anyone else can have
I move that we keep it the same, third Wednesday, same time.
I'll second that.
There's been a motion made and second. Any other discussion? Hearing none. All in favor say aye.
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 Opposed? Motion carries. Next is the resolution supporting youth homelessness demonstration program, the YHDP grant. Who's doing that?
Thank you, Mr. Chair, and I've invited Scotty Ard from Salvation Army Grace Place to provide an overview of this grant opportunity and the benefits to St. Croix County should it be approved.
Okay, we're on. Well, welcome all new board members. I'm Scotty Ard. I'm the Housing Navigator for Salvation Army. The territory that I cover essentially runs from Bay City, often La Crosse, all the way up to Superior. My job is to find homes for persons who otherwise have been homeless, are on a permanent supportive housing program, TIBA program, rapid rehousing, or persons who are in immediate need of assistance. We work with all families and all persons. The grant that is before you today and the copy of the grant is within your packet. I hope you've reviewed it. This is the Youth Homeless Demonstration Grant. The purpose of the grant is to address the issues of youth homeless and the many segments of youth homeless that we are currently looking at in West Central and in rural north of this Wisconsin region. The biggest issue we have with youth homelessness is that shelters, which are few and far between in West Central as well as rural north, are not equipped to deal with those who are 18 and under. Now, understand that on a federal level, youth is considered 0 to 24. So when we look at this grant, it will address persons who are 18 to 24, 16 to 18, below 16, and infant. Families can be made up of not adult parents, but youth parents. We call them unaccompanied families. Essentially, you may have a sibling who is 14 to 24 and is caring for younger children by themselves. Parents may be incarcerated, they may have AODA issues, mental health issues, or the family unit has dissolved. These are some of the biggest priorities that we have, and surprisingly, we have them in St. Croix County. The one issue that we do see a great deal of is children aging out of foster care. When that child is 18, regardless of the time of year, they are no longer eligible to receive services from foster care, and they are on their own. Often, these young adults do not have anywhere to go or a direction to go. This grant addresses that as well. I'm just going to give you some quick numbers here so that you understand what the significance of this grant is. And this grant does not cost the county a dime. There's no matching funds. What I'm asking for today is your support of this grant on the submission that we are doing. The submission's going in regardless. If St. Croix County does sign on to this grant, then organizations such as Salvation Army will receive funding from it in order to do work and address issues in St. Croix County. If the county does not support it, we will still be doing the work, but St. Croix County will not benefit. So let's take a look at what we're looking at numbers in St. Croix County. This is part of the West Central Coalition. Barron, Dunn, Pepin, Pierce, Polk, and St. Croix. St. Croix County is outstanding with an estimated homeless rate in 18 to 24 year age of 847. In the 12 to 17 range, 274. In the 12 to 17 range, 493. And in the McKinney-Vento homeless data, which is data that we collect from school districts, we have 118. Those numbers are startling for St. Croix County. That's absolutely unconscionable. Now, please be aware, this grant is not going to solve all of these issues, but what it will do with partnerships, as you will see in your packet, we have listed all of the partners that are currently in play. We will be establishing and providing temporary housing for youth until we can establish a permanent housing location to accommodate youth homeless with family, youth homeless with children, pregnant youth, all of the classifications. One of our options that we are looking at right now and researching and speaking with is utilizing dormitories on the University of River Falls campus, which are empty during the summer, underutilized space. This can be our launching pad for our housing programs. But as we're coming into the summer months, this grant is coming in at a perfect time, because now we have the opportunity to really look at what sites are currently existing that we can utilize for temporary housing until we can actually get funding to put a permanent site in place. But what I'm asking of you today is to support this grant going forward, push it on to the full board, and hopefully the full board will give its approval, and that will make St. Croix outstanding within receiving services from this grant. Any questions?
You mentioned that St. Croix County would benefit from this grant, but that also a private entity could still apply for that grant, correct?
A private entity cannot apply for this grant. This grant cycle is already in play. So this is for nonprofit organizations, those specializing in youth homelessness.
Thank you.
You're welcome.
Any other questions?
I would move to support the resolution.
Second?
I'll second.
But a motion made and second? Go ahead, Sean.
Yeah, I guess how much say would the county have, if any, as to where this was located? I know temporary might not so much, but a permanent location if the county were to approve this.
I can't even go into that 100,000-foot look. We're not even at that point. The idea is to start to develop. Right now, the best emergency plan that we have in place that is operating are scattered sites. Families who have been identified, who have been security cleared, have been trained to deal with homeless youth. That is currently what's in play. What we're looking at in the future and hoping that this grant will help to base is a permanent site to address youth homelessness. That's several grants and possibly several years down the road.
Mr. Chair. So I'm assuming this is like other resolutions and other grant work where it really helps the probability of you receiving this grant with support of the counties for which this would be. And so it's with other projects, I've known that this has been true, where it helps to have support, and then we, as the details start to flesh out, there'll be more things that you can tell us.
It certainly does on federal grants such as this help to have the county, which may be a recipient of services, signing on to the grant saying, yes, we support this. It's not costing the county any funding. There's no matching. It's the only thing it's costing you is your time to listen to me and to vote yes on this. So essentially you're opening the door to say, yes, St. Croix County wants to help its homeless youth, and we're going to say that loud and proud by giving this an approval vote and taking it to the county board and having an approval vote there.
Any other questions? Go ahead.
Yes. So with the grant comes in and then it ceases. Whose responsibility fiscally follows after that if the grant money dries up?
Within your packet, you'll see that information. It's listed within the grant plan. However, with any grant, the grant is dependent on whether this is a renewable grant. This is a renewable grant. And so therefore, based on service numbers going forward, when we apply again for this grant, and grants have many parameters, so I'm not going to get in the weeds on this. I'll try and make it simple. If you have further questions, let me know. But on this grant, it is renewable. We know based on the services that we provide to St. Croix County currently, to the residents of St. Croix County for homeless housing, management, education, services, that we are going to be successful in the west central counties. Pierce, Polk, Dunn, Polk, St. Croix, we know this based on our historic numbers. Same thing in rural north. We've been working this machine for a very long time, so we know what we're doing. The grant, when you get a grant like this and you're looking at other projects that aren't covered, such as permanent housing, we're already starting on other grants to provide a financial basis for that. Then we look for a partner who is interested in tax credit properties to help build that dream. Then we get them involved. Then we write another grant to get further funding for it. And this is how we keep everything going and building and providing services.
I dare say that a vote no with this does not mean we don't want to cover our homeless. So, thank you.
Any other questions? Are we ready for a vote? Say aye.
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 Opposed?
Nay.
Nay.
And how many was that?
Was that 5 yeses and 3 nos?
Motion carries. Thank you, Scotty. Next item on the agenda is Health and Human Services monthly financials.
Okay, good evening. Being that we have some new members today, what I was going to do is go through the structure of these financials. They may be different than what you see at some of the other boards for people who have previously sat on them. Page 153. Okay. So the first section is Hhs Fund 225, so that's as a whole. The very top part is 4110 is general property taxes, so that's the tax levy. 1/12 of that is allocated every single month. The next group of revenues that we have, so I guess this whole first section is revenues. Our next section is 4-3 numbers, and those are our state and federal grants. Those come in, I'll kind of go into billing a little bit later, but we get all of our expenses, we submit claims, and a month or two later we receive those payments. So those are significantly further behind in the timing of when we receive those payments compared to some of our other revenues. The group of revenues after that begin with 4-4 and go all the way down to the 4-8-7 are what we call local revenues. So those are services that we bill for. So our mental health, substance use, where we're billing Medicare, medical assistance, the other services we do such as inspections, permits, those are all part of our local revenues. Those get billed monthly and those payments come in on a regular basis. The Hhs fund balance is a cash basis, so our revenues are counted as the money comes in the door, except at year end, which I'll kind of cover a little bit later. The other part, information that we have at the top, so if we go through the columns, we have our fiscal year 20 data. That truly is final data. The fiscal year 21, although it indicates final, is not quite finalized yet. We have a nursing home audit just finishing up. We're just starting our Health and Human Services audit, so we will have journal entries from the auditors that will affect our final 2021 numbers. We have our prior year to date, so part of what I'm doing is comparing where we were in April of 2021 to April of 2022. The next column over is we have our budgeted 2022 numbers. And then, as I said, so the fiscal year 2022 is just where we are year to date. The next column is just the difference between our budget and what we've recorded so far, and then that percent. The section below the revenues is our salary and fringe, so that's just all staff salary and wages. And then on the next page, we have our operating expenses. And again, this is all of our Hhs departments rolled up into one. After that, we go in department by department. So we start, they're listed numerically, so public health is first with the 4110. all the way through our Aging Disability Resource Center, and then our admin at 4920. So if we run down to page 169, we'll start our health center campus. And again, the 4,200, that's the 3 different departments rolled up into one. The structure is the same with the revenues first, the salary and fringe, and then our operating expenses. And then that's broken down into just a skilled nursing facility, Kitty Roads, which is our dementia unit, and then Orchard View, which is our assisted living. Last but not least, so we have then Veterans Services. They are housed over at Health and Human Services, but they're actually under Fund 120, so they're part of the financials that I review. And then on our very last page, just because so many of our expenses are driven by the purchase services. So these are hospitalizations, costs for placement, contracts for our CCS providers. That is the bulk of our operating expenses. So we've kept just a little graph here for you to help monitor those expenses more closely. That is usually something that I'll go over if I see a trend that we're going to be over our budgeted amount or over where we were last year, just to point that out, and then discuss strategies that we're using to address those if it can be. One of the things I do want to point out, so back, if you scroll back up to the healthcare campus, we do not have March or April revenues are posted in here yet. So because of the timing of journal entries and the timing of when this report was printed, they are not included in here. Revenues for the health center campus for those 2 months were, oops, I didn't break it down as a total. $860,000. It brings our total revenue to $1,777,298. So as a whole, the healthcare campus is at a positive number right now. Any questions for me that you want me to go over at this meeting, or other information you want to see going forward?
Would you like to let our new folks know what the process is when we send the bill down to Madison, and that delay that comes back on there? Sometimes it doesn't show correctly on our map. I mean, they don't match up, but that's the reason why, is we're waiting for that refund to come back.
Yep. So that would be part of our state revenues. So what happens, like during the month of, we're in May, we just gathered our April expenses. We submit those to the state by May 15th. And then sometime in June, we get that revenue back. CARS is much more timely. Our GWAR, which has to do with our aging department, they just now processed January, February, and March claims. So we're submitting claims monthly, depending on their processes, is when we get those funds back. They also have, some of the federal grants have very specific time limits. They'll only release some of the money through April, and then there's a pause, and they don't release the rest of the funds until July. So we continue to submit our expenses every single month, regardless of whether the grant money is available or not. The other thing that happens that impacts us is what they would call a deobligation and a reobligation. So if we get to the end of 2022, and the grant was for $200,000. We submitted claims of $250,000. Some other county didn't use up all of their grant. They will take the grant money from that and redistribute it to us. And that's one of the reasons you'll see those year-end numbers continue to change, especially on the revenue side, all the way up through May as we submit final reports for prior year expenses.
Any other questions? Thank you for the report.
You're welcome.
Presentation of the 2021 Health and Human Services Annual Report. Bob, you're up.
Thank you, Chair Telejohn. The good news is that the packets are generally not an inch thick when you come to an HHS board meeting, but the annual report, we intentionally put some detail into it to act as sort of an orientation for all of you and to maybe serve as a reference in the future if you want to go back and look at what a particular division does or what the department does in a particular service area. So we did consciously put some extra narrative in there to help explain what the services are that we provide. And what I'll do today is I'm not going to read through the whole report, obviously, but I have some talking points for each division that I'll sort of high-level talking points that I wanted to bring your attention to. And then I've also invited all of the division managers to be here tonight to answer any specific questions you might have around the division work that they do. One division manager, Michelle Lesha, couldn't be here tonight, so Jessica Dodge, Supervisor in Children's Services, has joined us. But I thought what might be helpful for all of you to put a face to a name, since they're all here. Sandy's on Zoom. Maybe I could have them stand up as I introduce them, and you could see who does what at HHS. So I'm going to put them on the spot, and I'll just go down my list here, but we'll start with Colleen, who's Executive Administrative Assistant and helps me. Yeah, you have to stand up. No, you don't have to.
I'm not very tall, so this mic looks ridiculous.
And Colleen helps me keep everything. She helps keep my life organized at HHS, so she's invaluable. Tammy Wilson. Tammy's a Records Division Supervisor, and again, one of those positions that we couldn't do without. She well, I'll get into it with the report, but that's Tammy with our Records Division. Next would be Kristin Newton with our ADRC. Kristin's our ADRC Administrator. Thanks for coming. Char Lopez is our Behavioral Health Administrator and Operations Manager. Hi, Char. Michelle Lesha couldn't be here, like I said, but Jessica Dodge is here. Where are you, Jessica? Jessica's with Children's Services, a supervisor there. And Becky Kerr is our CCS Administrator. There's Becky. Rhonda Brown with Economic Support. Hi, Rhonda. And Sandy is on Zoom, Sandy Hackenmiller. I don't know if we can see her or you'll... Okay. Speak, Sandy.
Hello.
There she is. Thanks, Sandy. Kelly Ingen is our Public Health Administrator and Health Officer. Hi, Kelly. And Faye Strenke, who I don't supervise, but who is nonetheless a part of our team there. So those are the managers that help put together this annual report, and their work is valued beyond belief by myself. I can't imagine doing my job without having a team like this working with me. So thank you to all of them. Thank you for coming tonight. And they'll be available, like I said, to answer questions that you might have as I go through these talking points for each division. So backing up a little, welcome new board members and new HHS board. And Colleen, I'm sorry, I have to thank Colleen because she puts all of the information that we gather from all the divisions together in a coherent format, which is no easy task, is it? No. All right, so moving on to the division updates, I'll start with administration. These are some updates I might not have put in the board packet. They're from me, just around some changes in 2021 that you might want to be aware of. But in 2021, Michelle Lesha was hired as the Children's Services Administrator, and this is on page 184 of the board packet. I'll try and reference the page number for you. Michelle was hired in June of last year as the Children's Services Administrator, replacing Julie Krings in that role. And Operation Manager duties were also a part of what Julie Krings did before she left, so we reassigned those duties to Char Lopez, who is now our Operations Manager at HHS. During 2021, our economic services moved from having a location within the HHS building to remote work. And they've continued to do remote work, which freed up a space that we then moved our finance team into. If you were on the tour, you might remember it. It was a hallway. It was very quiet and full of clicking keyboards. And then, let's see, in December of 2021, this past December, Brad Beckman, who was the ADRC administrator for, I think, 10 years here at St. Croix County, retired. And we began the recruitment process to fill his vacancy, and in January hired Kristin Newton as the ADRC administrator. And then lastly, in the spring of 2021, this isn't in your annual report, but just as a bit of historical knowledge, HHS applied for some ARPA funding through proposals we submitted to the board. Those proposals were funded, and we began planning and designing many of the interventions that are now in place that you may have heard about already with co-responders with law enforcement and that sort of thing. So I can talk more about that in my report, but I wanted to make sure you were aware of that. And with that, I believe I'll just move right into a review of the different divisions on this report. And again, these would just be 2 or 3 bullet points for each one. And then we can invite the managers to help answer questions that you might have. And page 187 is the report from the Records Division. Just things to bring to your attention. The Records Division scanned and uploaded over 26,000 documents in 2021. This reduces storage space, it enhances privacy and security, and assists with document retrieval and increased productivity, and improved compliance, disaster recovery, and department collaboration. Also in the Records Division, they work to ensure that the EHR, the electronic health record, is updated to comply with the Cures Act, allowing consumers the ability to access their medical records electronically. Come January 1st of next year, we'll have to be in compliance with that Cures Act, where we have a mechanism for consumers, a portal in our EHR for consumers to access their medical records. There's a time frame by which we have to have those records available. So Tammy's been working, and her team have been working on that. Moving on to office support staff on page 188 of your board packet. The call numbers remained consistent in 2021, but calls into the facility became longer in duration and more detailed as consumers searched for resources and assistance with COVID-19 infections as they surged again last fall. There was a lot of questions from the public as to where to get tested, where to get vaccine, all kinds of questions related to COVID that the front desk staff had to be knowledgeable about and respond to. Mail volume also increased in 2021, likely pandemic-related. Signatures were required on documents for people who didn't use technology or didn't have technology to do that electronically. And our Spanish-speaking interpreter continued to be busy as our staff relied on her for complex cases for translation rather than using the language line. And she is wonderful, by the way. Page 191 would be ADRC, Aging and Disabilities Resource Center. And some highlights from that include, despite the pandemic, ADRC services and programming continued with measured increases in nearly all service areas. And while congregate meals were down in 2021, where people meet in the senior centers to have meals, those were closed for a good portion of 2021 as a COVID precaution. The number of meals were down in those sites, but home-delivered meals were increased by about 5,000. So we were out there, we weren't, I wasn't, but we were out there as the ADRC delivering meals to people in their homes by an increase of almost 5,000 meals. So. And then the last thing on ADRC that I was going to mention was a recent statewide study was completed in 2021. I think it's in the board, in the annual report. that demonstrates that for every dollar invested into a Wisconsin ADRC, there's a return on investment of about $2.48. It's evidenced by reduction in hospital readmissions and emergency department visits, by helping people stay healthy, helping them get connected to benefits that they're entitled to, serving them meals and helping them stay in their homes. We reduced as a state reduced hospital admissions and emergency department visits, which saved, I think it's in the report there, but saved X amount of dollars per hospital admission per emergency department visit. And then I'll just move on. Oh, I did want to mention one other thing, and I don't know that this is in the annual report, but we just had a volunteer banquet for ADRC volunteers last week, I think, I think it was last week. This is for 2021 now, but our volunteers donated approximately 70,000 hours of time in 2021, assisting our seniors and people with disabilities, resulting in an equivalent of about $184,000, almost $185,000 of savings if you calculate those hours of time at a certain rate. It's a very nice banquet, and we thank the volunteers.
Yes, Dave.
Did you say 70 hours?
70,000.
70,000, okay. Thank you.
And go to page 199. Oh, the other thing we added this year to the annual report was organizational charts. So you can kind of see where the FTEs are assigned and what positions are assigned under each division. I don't think we did that in the past, but for your information anyway, I thought it would be helpful. And since the packet was already an inch thick, what's another couple pieces of paper? But I think it's beneficial to see sort of what the positions are and how they're structured under each division. So on page 199 is the Behavioral Health Division. What I was going to mention here was adult protection and elder abuse cases continued to increase in 2021. There was a spike in crisis calls in 2021 with an increase in voluntary hospitalizations and a decrease in emergency detention admissions. And the other thing was a hospital bed capacity was reduced due to COVID-19, leading to an increase of admissions in the Winnebago Mental Health Institute. A lot of facilities reduced their bed capacity or weren't open at all who provided residential or hospital-based care, so we had a difficult time finding placements for folks that needed, with a severity of illness that needed that level of care. And lastly, in behavioral health, we saw an increase in outpatient referrals for substance use disorder and mental health therapy, which impacted our wait list. Specific populations are still given priority, have always been given priority, including pregnant women, persons with IV drug use, parents and family members with child protection involvement, justice involved, and treatment court clients. So we continue to prioritize these populations for admission when they're on the wait list, which, is what we need to do, but it pushes back people who might not have that high priority, and the wait list tends to grow. In children's services on page 206. Children's services has had an increase, a continued increase really, in out-of-home care numbers in 2021, many of them due to parental substance use concerns. This was an issue in Hennepin County. It's an issue everywhere, really, where parental substance use is a key driver of costs related to child out-of-home placements. We're aware of that, and we're trying to take some steps to address that specific concern with parents. It's one of the reasons they're a priority in our admission to behavioral health services. But we're trying to take some other steps now that I won't go into in great detail, but that are intended to help support parents and parents with young kids outside of formal service delivery. I'm partnering with our community partners like Family Resource Center to come up with ideas for how to provide support to our parents and parents with children in our community that It accomplishes two things. It gives them the support they might need, but it also softens the image of the services center a little bit for the public who might see us as a place you don't want to go unless you have to. This would be a way to invite the public to come see us for a positive experience that doesn't involve a formal oversight from our Children's Services Division. I said more about that than I intended to. But another bullet point under this division was youth justice staff were trained in the implementation of evidence-based assessment. It's called the Youth Assessment Screening Instrument, and that assessment guides workers with designing interventions for youth based on their risk level. Children's Services also received a grant for foster parent retention and recruitment in 2021. This grant allows us to provide support to current foster parents that are licensed in St. Croix County, as well as help us increase the number of service providers for our kids that need foster homes. Page 212 is Comprehensive Community Services. CCS program. And enrollment in CCS had decreased during the 2020 year as a result of the pandemic, but the enrollment numbers have increased in 2021 to pre-pandemic levels, and they continue to increase in that program. CCS is a Medicaid eligible program, so people have to be Medicaid eligible to be part of it. So we get reimbursed through Medicaid for all of the services that we provide in that program. And I don't know if Faye wants to talk about the reconciliation process for CCS, but if you have questions about that, we can answer them. CCS receives about 7 to 18 enrollments monthly, people petitioning for care, and many of these are children with mental health needs. CCS is intended to serve people with substance use and mental health needs that don't require a residential level of care, but might require a more intensive kind of support in the community. And they offer a variety of sort of non-traditional approaches to behavioral health interventions, equine therapy, boxing even, but kinds of things that might engage people in this discussion around their behavioral health issues that don't look traditional in say, an outpatient setting in a clinic or something. And CCS has shifted a regional project manager under the CCS shared services model. We work with Pierce County and Barron County. Am I right? Eau Claire? I'm sorry. Eau Claire and Barron County, right? Yep. Yes. Sorry about that. So we moved a regional project manager who oversaw projects for all 3 counties under CCS to a position within our St. Croix County CCS program to allow a greater focus on contracting with providers and reducing strain on the fiscal department. There are a great many contracts that are done as a result of the providers that we contract with for CCS. Again, that's reimbursed through Medicaid to support those efforts. But the fiscal department and our fiscal and contracting staff were overwhelmed with, I wouldn't say overwhelmed, they were very busy with contracts and navigating all of these different contracts with CCS and all of the other things that go on in HHS. All right, if we can move on to page 215 in the board packet. It's our economic support services. And through 2021, as a result of the federal public health emergency, CMS temporarily waived certain Medicaid and children's health insurance program requirements and conditions, so we didn't remove people from their health insurance or food share benefits during the public health emergency, and that, in fact, that's still in place, so those people maintain their benefits for now until that public health emergency ends. Easing of these rules helped to prevent people with Medicaid and CHIP, or the Children's Health Insurance Program, from disrupting or losing their health coverage during the pandemic. Moving on to the healthcare campus on 221. Thank you. The healthcare campus has been challenged in keeping residents and staff safe for the past 2 years of this pandemic. They're held under very strict COVID regulations from federal government and are currently required to comply with a vaccine mandate. They've had to navigate a lot of very strict regulations with respect to the safety of this population that's very vulnerable to infection from COVID-19, and they've done a very remarkable job, really, of preventing infections and preventing any serious illness or death. Admissions to skilled nursing continue to decline in 2021. This reduction directly correlated with hospitals reducing elective surgeries due to COVID-19, which led to fewer referrals for rehabilitation. And lastly there, actually conversely to that, the average daily census for Orchard View or independent living increased in 2021, more than doubling from 2019. And lastly, it would be public health on page 226. Public health is required by the state to provide an annual report as, and you're all serving as the health board for public health. But their annual report was completed as I was, and Colleen and I were putting together this annual report for HHS, so we just took with the work they had just done on their 2021 annual report and included it in this packet. But some takeaways from that are the emergence of the Omicron variant in the late summer, fall of 2021, once again, required a public health division to ramp up contact tracing, disease investigation, testing, and vaccination clinics. Limited term public health positions were maintained through epidemiology and lab capacity funding through the state of Wisconsin in response to the COVID-19 pandemic. Those limited term positions were primarily utilized for contact tracing, disease investigation, and helping with clinics. St. Croix County Public Health is, I just said that, required by state to provide annual reports. This report that they provided, I think, does a nice job of showing an overview of all of the areas of the Public Health Division and corresponding data related to those areas. And I already said the HHS Board of Services, the St. Croix County Board of Health. That's my Reader's Digest version of the 2021 annual report, and I would welcome any questions. If I can't answer them, I'll invite one of the managers to come up and help me. Thank you.
Thank you. Bob, any questions? Go ahead, Dave.
This one is probably for Kelly. Where are we at with our level 3 status? We're still at a level 3. Could you explain to this board what that means?
Thanks for the question. So if you're referring to like what level of health department we are, is that your question? So in the state of Wisconsin, the statutes work that we actually are one of the only states in the whole union that has these different designations of health departments. You can be a level 1, a level 2, or a level 3, and depending on who you have in capacity within your health department structure and what kinds of programs you run determines that 140, we call it the 140 review process. We are level 3, which is the highest health department, or the biggest, I guess. And does that sum up your question? We are level 3.
And it goes through a huge amount of time. Deb and I know all the time that you have to go through, and it's one of those that you don't gain that overnight. And the process comes every 4 or 5 years?
It's every 5 years, and we're actually due again for our 140 review. That's what the process is called, and the state comes in and evaluates all our programs and what we're doing, whatever we base on our submission. We have to have 13 programs to qualify for a level 3 health department, as well as then, as I said, some different staffing capacity, a lab or a CLIA waived lab, which is a technical term that the medical people may be familiar with. So, yeah. no, it is a big undertaking, but it is required by statute.
And correct me if I'm wrong, over the last 3 or 4 years anyhow, St. Croix County and Public Health has been rated in the top 7 or 8 in the state.
Hey, you know what? I really thank you for asking that, because in 2020 we were the healthiest county in the state, and we didn't get any PR or any publicity on it because we were dealing with something else. And we were the #1 healthiest county in the state, which is amazing. Last year, I believe we dropped, I think we were #2, and this year we're #3. And if you're ever interested in the county health rankings, it's a national model that ranks every single county based on measures, health measures. And it's, yeah, national. Founded in Wisconsin, though, so it's pretty cool.
And board members, I think that says a lot for our health department in St. Croix County. They've done an outstanding job, especially with all you've had to go through even this last 2 years. You guys are the best of the best, and it shows in those rankings and keeping us at a level 3, and we do appreciate that, Kelly. Thank you.
And I just want to say, it isn't the health department that makes us healthy. It's everyone here that lives here and plays here and works here. So it's great that we get a little recognition, but it's really the health of the people that determine where those levels and measures and how they're measured against other counties. So thanks.
Any other questions on the annual report? Thanks again, and thanks for all your leadership, and thanks for all your people behind you for all your work. Health and Human Services Director's Report. Didn't you just do that?
Thank you, Mr. Chair. Well, I did the report for 2021. What I put in your packet was some initiatives that we're currently working on to kind of bring you up to speed on some of those. So if you don't mind listening to me for a little bit longer, I'll touch on some of these. And I know, Mr. Chair, you've been very interested in the healthy and affordable housing or affordable housing effort here in St. Croix County, and I wanted to let the board know that there was a grant received by the United Way of St. Croix Valley that essentially was, the grant was designed to do a lot of the things that the HHS board was previous HHS board meetings, the board was interested in doing, which was to gather together stakeholders with who were subject matter experts or experts in the field of area of housing, to bring them together and formulate ideas about how to address housing issues in St. Croix County. So I attended, there's a stakeholder meeting that this United Way grant made possible. There's a facilitator involved, and there's a series of stakeholder meetings that will be used to discuss some of the issues that we're facing here in St. Croix County, and getting to a place where we have recommendations we can bring forward to policymakers for how to improve housing and some of the challenges with housing in our county. There was an agenda that was put out for this stakeholder meeting after the board packet was published. But essentially what this first stakeholder meeting consisted of was those of us who attended, it was an opportunity for the facilitator to gain an understanding of what we were interested in learning about and what kinds of things triggered our interest. And it was such things as they presented some ideas for us to consider. And it was some things like upstream investments. In looking at you may have heard the term, but social determinants of health, or the ecology in which people live, and understanding better how various things within a person's ecology affect not just their health, but their ability to stay housed and their ability to work and stay healthy. A large part of this seems to be an effort to look at how health and housing connect, and how do we make that bridge apparent for policymakers to understand that the connection there is inseparable. So you have an effort to look upstream at things that might impact people's lives prior to them needing emergency housing, or their health deteriorating to a point where they're unable to work, things like that. And some of the things, most of the things that we try and do with some of our newer initiatives are in targeting upstream solutions for people's health, those early preventive kinds of efforts. And a framework for housing investments, what safe and stable housing looks like, what affordability looks like, what neighborhoods look like in St. Croix County, and then using a multi-sector approach or even a multidisciplinary approach to understanding these issues and trying to come to some resolution about what might work here. Policy landscape was something I was interested in. How do you develop policy language that resonates with policymakers, helps them understand the true nature of the issues that we're facing, and without overcomplicating the presentation that you're giving. So they will help, I think, with this effort will help with drafting policy that maybe has a meaningful kind of impact on changes to some of the current challenges that we have, which is a lack of affordable housing in not just St. Croix County, but in western Wisconsin. So this initial meeting was an opportunity to get together for the first time and begin this discussion, and I'll just have to keep you appraised as this effort moves along as to what the progress is and what some of the ideas are that are surfacing. Let's see if I missed anything with that. Just to reiterate, the objectives of this grant seem to align pretty well with what the HHS board had wanted to do in previous board meetings, so it seemed like a perfect timing to be involved in this effort. And the next thing I was going to update you on is the American Rescue Plan Act, or ARPA, initiatives that we've been funded for through board action last year. These initiatives are primarily designed to provide early intervention and crisis services in community-based settings and at the government center here. In 2021, we began the planning and recruitment and program design for many of these initiatives, and then in early part of this year, I give much of the credit to Char Lopez for organizing this and making it happen, but we've been able to hire some of these positions that go in, they're case managers primarily, that go into the community, work with people in environments where they may be at high risk for crisis kinds of events, emergency housing, recovery housing, really any location within our community where there's a need for one of these case managers to work with someone who might have a mental health or addiction-related crisis or need of some kind. It wouldn't have to be a crisis. We're also currently, we just hired a second person to serve as a co-responder with law enforcement. That would be someone that goes out with law enforcement to crisis events and helps to talk with the person or the family or whoever is in crisis. The idea there is, of course, to help relieve law enforcement of some of the time that they have to devote to those efforts and to have a better outcome through having a trained professional be a part of that event. These two case managers, we have 2 FTEs right now, they are available to any law enforcement agency in the county. So as you can imagine, there'll be times when they won't be available to go out on a call, but for the most part, we hope they'll be able to respond to many of the emergency or crisis calls that we receive related to mental health and addiction. And then they help connect that person to whatever help they need. There's an initiative that we're working on right now that was funded through ARPA proposals last. Yes, I'm sorry. Oh, I'm sorry.
Yeah, those I guess responders that go out with the police departments on mental health calls, are they just mostly on call? Do they work shifts and go out when calls happen during their shifts? How does that work?
They work shifts, but Char, could you come up and please answer that more detailed? Because I'm not sure what those shifts are.
Currently, we have one that is working a 3 to 11 shift and a Monday through Friday, 3 to 11. And we literally just hired the other one. He's away at training this week. There is an incredible amount of training that goes along with crisis work, and so we have another staff who is available to, who is kind of on call, who can assist in those. That is their shift, and they are at the beck and call of law enforcement. And we have MOUs that are set with every one of the jurisdictions except for Star Prairie, and there's one other that haven't gotten back to us yet, but most of them. And most of them are covered in the afternoons with Sheriff's Department anyhow, because they're part-time.
So do the responders go out with the Sheriff's Department as well, or is it just, okay?
Yeah, they're actually, dispatch is the contact, so law enforcement will call dispatch, and then dispatch will immediately call them and push all the information. So they have a radio, they have the app on their phone, and they're able to quickly look to see if there's a crisis plan on file, or if that person is connected before they go out, so they have some information at hand.
Thank you, Shar. The other initiative I was going to mention that's still in the planning development stage is we received some ARPA funding for development of withdrawal management services. We also received an RFP from the state for developing community-based withdrawal management. It's what detoxification, it used to be called detoxification. So we're looking at that grant, and we're looking at the ARPA funding that we received and working with community partners to see if we can put together a proposal for that. This would be to serve people who are intoxicated from any drug or who may be in withdrawal from any drug and who may have co-occurring mental health conditions. The idea here would be, and I used to run a place like this, a couple places like this in the Twin Cities. The idea here is to provide a more comprehensive set of services for people with those kinds of needs, and to reduce hospital admissions, to reduce jail events for these folks, and really provide them with a better quality of care and help them connect with ongoing support services. So it's a big deal, and I've seen it have a huge impact on not just the financial impact, but a human impact on on reducing crisis events, reducing the kinds of things where you have somebody taken to a faraway hospital in handcuffs, and instead treating them humanely and as though they have an actual chronic illness, which is what the case is. So that's in the works, and it's complicated, and we're working on it, and I'll keep you updated as we get further along with that grant. The grant's due in August, so we have a little time to put together a plan. And the other thing, number 3, would be the opioid settlement funding. Administrator Witt has mentioned that the opioid settlement dollars that St. Croix County will receive should arrive in June or July, I believe. And once that money arrives, we see how much we get, and then the duration of time, and all of that. We'll put together some proposals around how we would suggest spending that money on substance use disorder. Hopefully we can use that money in ways that improve the system of care, at least here in St. Croix County, even though it might go a bit beyond opioids, but addiction as a whole is an issue that I think we need to address. So we won't go outside the scope of what's eligible funding for that, but our proposals will be tied to trying to improve the system of care for addiction. And counties receive 70% of those settlement dollars. The state retains 30%.
Excuse me, quick question. So was that, I'm trying to remember if that fund was going to come as one lump sum, or is that going to come over a period of time for the opioid settlement?
My understanding was this would be distributed on, there's a variety of options for that, but I'll let you answer.
Well, not so much options, but it's going to be distributed over a number of years. There is an option where you can cash it out and get a lump sum in the front, but it'd be a smaller dollar amount than, but basically selling the annuity. So details on that are yet to arrive.
What I was just touching on was that the state retains 30% of those opioid settlement dollars. They've held stakeholder meetings with providers to see how they might spend that money. Again, my input on that was to look at systems of care improvements and not throw the money at individual kinds of problems as they pop up. There's a tendency to do that in human service work, to throw money at the problem and then all these other problems don't get resolved, and it doesn't really help in the long run. So we'll see if they take that advice from the St. Croix County HHS director. And the other thing I was going to make you aware of, I think Adam just put out an announcement about this. There's a mental health awareness symposium that HHS will be hosting alongside the medical examiner's office and Veteran Services Department on June 8th at 6 o'clock in the evening at Northwood. And what this symposium was, the genesis of this symposium was concern around suicide deaths in St. Croix County and some of the precipitating factors involved in that data. What our intention here is really to engage the public in discussions around mental health, addiction, and suicide in a way that helps them feel more comfortable reaching out to us or anyone as a resource, anyone that can help them as a resource and help provide them with those resources. We'll have a speaker that Phil Landgraf from Veteran Services has arranged for. He's a vet, but is also a therapist. And we'll talk a little bit about his experience in working with people with PTSD and other kinds of trauma. And then we'll have a panel discussion along with some other behavioral health and overview data of suicide deaths and mental health and addiction. But we'll have a panel discussion at the end where we can answer questions from the public or concerned family members or anyone. So you're very much invited to this. It's free, of course. We'll have resource tables there. And as I said, Adam, if you want to elaborate on the announcement or anything, just to clarify.
Yeah, thank you, Bob. We did just before this meeting, we had actually sent out the press release to local media. Supervisors, you'll have an email in your inbox tomorrow morning. We're in the process of just putting together some flyer and marketing materials for the event. Earlier today, we did publish a suicide prevention page on our website that's available under the behavioral health section of the website. And the press release and the information you have in your inbox tomorrow will point to that as well. That's really just serving as a place where people can go to find quick resources if they or they know somebody who is going through a mental health crisis. A lot of that information is pointing back to our behavioral health team. We do invite all of you to show up to the symposium on the 8th. If you do have any questions about that, please feel free to reach out to myself or Bob, and we will be providing more information as we get closer to the event.
Thanks, Adam. All right. Next item I had for an update was the CJCC recently formed a juvenile task force, juvenile justice or juvenile task force, to look at our system of care for kids and families involved in the court system and who may also be involved in child protective services. To look at our current system and see if there are ways in which we can improve it, to provide more support or to provide better communication between our department and the courts, any number of things that might benefit the families that are involved in both scenarios in the court or in our Children's Services Department. That was that task force was just formed, and we met once to begin again those discussions on what we might focus on and what our objectives might be, and look at prioritizing those objectives for this task force. So I'll, again, report back to you as I learn more about the kinds of things that we're trying to tackle with that particular task force. And I know with Philip Golly coming on as the new Justice Support Services Director, he'll need some time to get up to speed, and he might have some direction on that as well. So. And I was going to mention, too, next week I'm off to a conference. I was invited to a conference in Vermont. It's called National Judicial Task Force to Examine State Courts' Response to Mental Illness. Oh, well, let me pause for a minute. All right, all right. This is an opportunity that came up. I was asked if I could go as a representative of the Wisconsin County Human Service Association, and it'll be myself and Diane Cable from Eau Claire. She's the director there for the HHS department, and the president of the WICSA Association. But they invited me to go as a way to examine, I'll have to read it because it says it better than I would, but it's a multi-state effort to examine the state system or the court system approach to people with mental health issues, people with addiction issues that enter the court system, and how does the court system and the community respond differently to those kinds of situations so that we're giving people what they need and really better managing that population within the courts. It's sponsored by, it's sponsored by the National, it's convened as a part of the National Judicial Task Force to Examine State Courts' Response to Mental Illness, organized by the Conference of Chief Justices and the Conference of State Court Administrators. So there's no way I would remember that, but through the National Center for State Courts. But it's an opportunity where the Wisconsin County Association is funding my attendance at this conference, and my hope is that myself as and Diane as representatives of WICSA, representatives of law enforcement, Medicaid, the courts, NAMI, and other counties can maybe put together some kind of strategy around how to work with people differently in the court involved in the court system with mental illness and addiction. In part of the comments in your packet, there's a list of things that they intend to address at this conference, but what's happened is jails and prisons have become de facto mental health institutions and detox units. And it's really an issue everywhere, so I'm guessing that's why this is a multi-state effort. But I'll be at that next week, and I look forward to it. I want to report back to you if we come up with some interesting ideas around that. And then lastly, yes, sorry.
Going off of your packet before, is Oshkosh the only mental health facility in the state, or are there others?
For hospital? Yes. Yeah, Winnebago. Is that it? Sure. Oh, okay.
So for Chapter 51 emergency detention, so the involuntary holds, we contract with Sacred Heart Hospital in Eau Claire, Mayo Health Systems in Eau Claire, and then Winnebago Mental Health Institute is the state facility. So if no other local contracted facilities are available, they go to Winnebago. We also work with Amory Regional Medical Center, and they take more of the geriatric mental health patients. They're a smaller facility, so they don't have very many beds, but we also contract with them. We used to have a contract, and we still may, with 2 facilities in Minnesota, but very rarely are used because they're full with Minnesota residents. So oftentimes they're going to Winnebago because there's no other local facilities available.
Thank you.
Thank you, Heather. All right. And the last thing I was just going to mention is that COVID-19 infections are increasing as these variants spread and vaccines wane. So I would just suggest monitoring the COVID-19 dashboard on the county website for more information around around disease trends and around vaccine and testing clinics that we offer at the Services Center. I believe that's all for my report, Mr. Chair, unless someone has questions.
Are there any more questions for Bob? Thank you, Bob. Request for future agenda items. Anything else that we need to bring forward on the next agenda? Anybody would like to bring forward, talk about? Otherwise, we'll fill it with something else. I don't think we've ever had a lack of agenda items. Anything? If you do have any ideas or questions, please contact. Any announcements or correspondence? No.
I would just mention that next month meeting will need to include the public participation process, which is a statute that we're required to obligate. We'll be reaching out to all of the people that we're contracted with, local law enforcement, schools, hospitals, clinics, etc. And then like Grace Place, any of the resources that we utilize to help all of the consumers here, that they can come and voice any issues, concerns that they would have regarding the 2023 budget process or services that we would provide in 2023. So that will be an agenda item next time, and it is an obligation that we have per the state to provide that meeting. So that will be one agenda item for next meeting, just so that you guys are aware. I will likely send you, there'll be a press release and then letters that will go out. I'll send you a copy of that. If you have someone that you feel would be interested in attending, you certainly can provide that to them. I just try and reach out as much as I can, and all of the administrators of the divisions get a copy of the letter, and they can provide it to any of the people that they work with as well. So that will be coming up at next month's meeting.
Thank you. Any other announcements or correspondence? Hearing none, I adjourn the meeting. Thank you, everyone.